All right, good morning, everyone. Thank you, Director Hartel, for joining us in this celebration today of the great strides we made toward more person-centered care for opioid use disorder through our MOUD program. Today's celebration is a culmination of several years of collaboration among everyone in this room to bring an evidence-based approach to treat opioid use disorder, prevent overdose, and sustain recovery. We appreciate the state of Michigan's ongoing commitment to amplifying this work and supporting medication for opioid use disorder as a necessary treatment option for opioid use disorder patients. For those of you who don't know me, I'm Sarah Scranton, the Vice President of Safety and Quality at the Michigan Health and Hospital Association and the Executive Director of the MHA Keystone Center. The MHA Keystone Center is the patient safety arm of the association, and we work alongside hospitals and health systems to advance safety and quality initiatives across the state and beyond. Let me just switch here. We have a lot of priorities that we work on. Our main pillars you can see here are harm prevention, safety culture, and health equity, and behavioral health, which I will talk more about today. The MHA Keystone Center has prioritized person and family engagement for many years, and so this initiative really falls in our wheelhouse very well. It reinforces the need for compassionate, human-centered care, which the MHA Keystone Center cares deeply about. We know the ways in which we interact with opioid use disorder patients is critical to their recovery. We also know that when individuals with opioid use disorder are not treated with dignity and respect, their willingness to seek care reduces dramatically. While there have been significant improvements in how we understand and treat substance use disorder, much work still needs to be done to address the stigma surrounding this disorder itself and medication for opioid use disorder treatments. There are many different highlights for the EDMOUD program, but I'll just talk about a few today. We need to keep persevering in our efforts to reduce the stigma associated with this. And I'm confident with the ongoing dedication of everyone in this room and our colleagues who aren't represented today that we can improve the experience and the outcomes of opioid use disorder patients. As strong patient advocates and anchor institutions in their communities, Michigan hospitals will continue to establish and foster partnerships with organizations and institutions who support individuals with opioid use disorder. We are all committed to ongoing training and education surrounding the best practices for treating opioid use disorder. The MHA Keystone Center continues to support these efforts with our online learning programs for both emergency department and inpatient MOUD services. I encourage any of our members in attendance today to connect with one of our team members to learn more about how you can continue to prioritize this critical work. With all this being said, it's clear that addressing the opioid epidemic with a collaborative approach is vital. Partnerships always seem to work best. The EDMOUD initiative is just one impressive reminder of the power that we have with partnerships. So with that, thank you to the Community Foundation of Southeast Michigan for engaging us in this important work and bringing us all together today to celebrate the accomplishments and plan for the future of this important work.